It's Angry Bill for Prehospital Wisdom with a quick field trainer moment. I need you to stop doing sternal rubs. The painful stimuli with a fist, you rub the knuckles on the patient's sternum. Knock it off. There's better ways to check for painful responsiveness than causing a big purple sternal bruise. It looks brutal, it looks terrible, whether it's in front of bystanders or a security camera or police cameras, the body-worn cameras, stuff like that. You're always on camera and a sternal rub looks terrible. There's better ways to check painful responsiveness or response to pain. Stuff like pen on a nail bed. For me, I like a little bit of pressure at the end of the sternocleidoid mastoid muscle right there. Also from the back of the mandible, aiming towards the tip of the nose. In that case, I can even hold a little bit of C-spine. It looks really subtle. It's not leaving a mark. It's not leaving actual damage or injury. So as things regard the nail bed pressure, all we're talking about is a normal pen on the nail bed and squeeze, right? Like from this side, we're just squeezing down on this part of the nail. And just like the amount of pressure that you can get from squeezing your fingers together is certainly enough to cause for a painful response. The sternocleidomastoid muscle is the muscle that runs from the mastoid process back here and inserts down on the medial side of the clavicle. On each clavicle, the medial side has kind of a bulb, a knot, and the SCM muscle bifurcates right at the very end where it inserts. Right at the top there, you're looking to push down. You're not pushing towards the neck. You're not pushing towards the head. You're not wrapping around the clavicle to pull on it or anything dumb like that. You're just pressing on top of the clavicle right there where that SCM bifurcates, and you're just pressing down towards the feet. For the mandibular one, the angle of mandible is where your mandible turns from horizontal to vertical. So past the angle of mandible at the vertical part, about halfway down, we're just shooting to push straight forward towards the tip of the nose. So we're just pushing that straight forward. I'm not looking to dislocate the jaw. I'm not wrapping around the mandible. I'm not doing anything like that. There's a pressure point back there that you can hit when you aim for the tip of the nose. Those are much better than the sternal rub. You playing the xylophone on someone's sternum, causing a big nasty bruise and everything else. It's not cool. It doesn't look good. It doesn't look professional. So knock it off. This is Angry Bill with Prehospital Wisdom with your field trainer moment. Here at Prehospital Wisdom, we know that medicine's medicine, but pre-hospital paramedics, EMTs, have skills and attributes and knowledge that are specific to them. We'd like to celebrate that. So make sure and like, subscribe, share this if it helps someone. Otherwise, leave your knuckles off of people's sternum, and I'll see you next time.